Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my partner is in intensive care after a bleed on the brain. We are worried that the intensive care team wants to switch off the ventilator. Help! You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is: my mother is in intensive care, ventilated with a severe flu. The doctors want to perform a tracheostomy and they are not answering my questions. Help! Jacqueline from New York in the United States writes: Hi Patrick, my mother has been in intensive care since the 11th of January and she's been on a ventilator since the 12th of January. She is morbidly obese with sleep apnea, COPD, and she's been admitted to intensive care due to having the flu. I'm the power of attorney for my mother and the doctors are not answering my questions or telling me the things I should know. They want to do a tracheostomy in the next few days. I feel like I'm not asking the right questions. Please help. Thank you, Jacqueline. Hi Jacqueline, thank you for making contact. I'm very sorry to hear that your mother is currently in intensive care on a ventilator. I've got some free resources for you to help you achieve your goals and also get your questions answered. In order for you to have peace of mind, control, power and influence, you need to indeed start asking the right questions, but you also need to have the ability to manage the intensive care team effectively. If you don't manage the intensive care team effectively, they will be driving their mainly hidden agenda from what's happening behind the scenes in intensive care. What's happening behind the scenes in intensive care is usually so powerful and has such a great impact on the decision-making process of the intensive care team that families in intensive care have no idea about the wheels that are in motion behind the scenes in intensive care. This could well be why the intensive care team isn't answering your questions appropriately. To start off with, Jacqueline, I would highly recommend that you download your free instant impact report here, if you're clicking on the link below in the written version of this blog on the website. Enter your email address and then check your email for immediate access to your free instant impact report or our free video. The free instant impact report will show you how you need to position yourself so that you can start managing the intensive care team effectively. You will also get insights about what's happening in intensive care behind the scenes. With your discoveries in your free instant impact report, you will have the tools to be able to have peace of mind, control, power and influence, no matter how challenging and difficult the situation you and your critically ill loved one are currently facing. As it relates to your questions about tracheostomy and ventilation, here are some of our free resources that will help you as well. The first article you should check out or video is: how long should a patient be on a ventilator before having a tracheostomy? So click on the link below this video to access the video or the article. The next article or video you should be looking at is: why does my loved one need a tracheostomy in intensive care? Another article or video we have is: tracheostomy and weaning off the ventilator in intensive care. How long can it take? And why doctors in intensive care insert a tracheostomy after an induced coma. So check out all of these articles or videos by clicking on the link below this video. You can also send me more of your questions through and I will answer them via email, or we can get on a free Skype consultation for about 15 or 30 minutes and I can answer your question there. I'm here to help. I'm wishing you and your family all the best. So, how can you have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.